Okay, welcome. Amazing. Welcome to the breakout room number 3. It is my pleasure to welcome Nalini Shugani from the Education Development Centre. And I'm really excited to learn more about building non-formal teacher resilient skills in Philippines, which is somewhere I've worked and somewhere very dear to my heart. So Nalini, over to you.
Great, thank you, Chris. Thank you everyone for joining us. I think this has been such a great discussion and session so far. As Chris said, I'm with Education Development Center, and EDC, as you may know, is a global nonprofit that implements programs in the United States as well as in 25 countries internationally. I'm an international technical advisor for our youth and gender programs, and I work in both development and humanitarian contexts, and often at the nexus where our humanitarian efforts and development efforts come to meet. Today, I'm going to be presenting on our USAID funded project called the Mindanao Youth for Development Program, affectionately known as Mydev. This project was implemented from 2013 and closed in 2019. The Mydev project was designed to contribute to peace and stability in conflict-affected Mindanao by increasing access to education, employability, and improving life skills and civic engagement opportunities for out-of-school youth aged 15 to 24 years old. For today's discussion, I'm actually going to focus on just one component of the project called the Foundations of Resilience Training. This was a mental health intervention that was designed to teach evidence-based psychological skills to build resilience, to address stigma of mental health, and to help youth and trainers process emotional health struggles. As most of you may know, Mindanao is a conflict-affected area, and it's an area of crisis and violence. In May of 2017, 4 years into the Mydev project, intensified conflict broke out in Marawi City. And during what is now known as the Marawi Siege, families and entire communities were facing an intensified magnitude of violence and destruction throughout a 5-month armed conflict. The Mydev project had been implementing a successful set of life skill interventions, and we needed to adapt quickly to a changing local context, which included the displacement and evacuation of over 300,000 families and communities from Marawi, including our project youth and including their families. Both USAID and EDC saw the need for adding a mental health component to support the youth in our education and employment programming. It was really incredible to have a donor that understood the need for some mental health focused support. The main goal of the Foundations of Resilience curriculum and training was to build resilience of our vulnerable youth, the marginalized out-of-school youth populations that we were working with. So I have to admit, our goal was focused on the youth and not necessarily on the teachers and the educators. We were focusing on supporting the underlying trauma that youth were facing. But what we quickly found out is that in teaching the facilitators, the trainers, to train our youth on resilience skills, and if we were asking the teachers and the trainers and facilitators to be agents of change in these communities, we needed to help them build their own resilience. And we needed to help them process the trauma and their own mental health needs. The trainers shared with us very quickly that this was very valuable for them and that the content that they were going to be training the youth on was actually very valuable for them personally, and they wanted more of it. I just want to note that I see some comments in the chat, but because I'm sharing my screen, I won't be able to see those. So I think Chris is monitoring those. But if there's anything anybody wants to say, just stop me. So in terms of our theory of change, our overall theory of change, you can see it here on the slides. And it's essentially that if the educators who are able to understand their own mental health needs and who have been trained in evidence-based psychological approaches which support positive mental health, then they can be effective educators of these skills for the youth that they're working with. If the educators have the skills to promote their own mental health, they're going to be healthier people. They're going to be more motivated. They're going to be more present in the classroom, and they're going to be better educators in general. So if the educators have the skills, then they can teach those skills to youth to support youth's mental health. Before I go on and describe in more detail the Foundations of Resilience component of our program and the curriculum, I want to just quickly talk about the term resilience, right? It's a term we all use a lot in our work. You see a definition here up in front of you. And what I would add to that is that resilience is also the process and result of successfully adapting to difficult or challenging life experiences, especially through mental, emotional, and behavioral flexibility and adjustments to external and internal demands. In the Mydev project, we layered this mental health intervention on top of our work readiness life skills and civic engagement programming. Our approach was overlaid with trauma-informed principles. It was developed in a very hands-on way and tested with a trained clinical psychologist. So the Foundations of Resilience training was 14 hours of training for youth. And the goals of this training were to help youth understand the connections between their thoughts, their feelings, and their behaviors, which then builds youth coping skills and strengthens interpersonal communication skills. The curriculum was really designed to build emotional self-awareness and to destigmatize emotional and mental health struggles. We were encouraging the processing of violence and traumatic experiences in a healthy, safe, and supportive environment. And we were developing healthy coping skills, anger management, to help youth navigate life's challenges. Many of the concepts, such as anger management and coping skills, were really new concepts for our facilitators and trainers and for all of our EDC project staff as well. So in order to teach the youth these skills, we knew we had to train the trainers in more than just the training material and content that they would be delivering to the youth. We knew that the trainers needed to understand basic psychological theory relevant to behavior change and trauma and mental health issues. We knew that the trainers themselves needed more content and more support and knowledge so that they could think strategically and be able to support questions and potentially sensitive issues that would arise in these trainings. It's because of this understanding, we trained a core group of trainers in 3 separate areas. So the first is trauma-informed educational approaches. You see the safety ground rules on the graphic on the left that guided that first component of the training of trainers. The second element of the training of trainers included training in foundations of adolescent psychology. So we needed our trainers to understand that adolescent and youth brains are not fully developed until their mid-20s or even later. Therefore, we needed to be cognizant of the cognitive challenges that our youth were facing and how teachers can support them. The third part of our TOT was on the actual content of the Foundations of Resilience curriculum. This Mydev project that I'm describing to you, we call it a resilience-informed youth workforce development program. And this project led to positive outcomes in this conflict context and other contexts where we have replicated elements of the program. Towards the end of the Mydev project, we held focus group discussions with 4 groups of youth for a total of 41 youth and 2 groups of trainers or facilitators for a total of 16 trainers. So I'm going to share some of the qualitative results with you here today. According to both the youth and the trainers, these were the 4 most helpful aspects of the Foundations of Resilience curriculum. The qualitative results showed that the most robust changes for students were seen in their ability to better manage their anger, in their ability to make better decisions in life through their newly acquired skills of weighing pros and cons of every situation. They acquired new coping skills, which help youth to calm down and help them think of solutions to problems as opposed to just reacting in the moment. They also gained a new awareness of their own personal vulnerabilities, which helped many youth and trainers to make better decisions for themselves when presented with tempting offers to maybe join an extremist group or join their friends in doing drugs and other negative coping mechanisms. Since this module focused on psychological and emotional learning, specifically by helping youth develop skills to see the connections between their thoughts, feelings, and their behaviors, and it was also emphasizing personal resilience skills. So youth were asked to rate themselves on these 5 elements representing key personal resilience items. So EDC conducted a number of impact evaluations and end of project evaluations, and I'm not going to go into all those details here today, but I'll share the links to our reports, and I'm happy to talk to anyone about them in detail at a later time or during the Q&A. So for the purpose of one of our studies, resilience skills were defined as the ability to think of consequences to oneself and others, to talk out a disagreement, to calm down when they're mad, to understand another person's point of view, and to stay out of fights. So I'm just going to quickly summarize the key findings from our quantitative data. Basically, the youth demonstrated an evidence of improved decision-making. They were changing their views on the acceptability of violence. They were increasingly considering consequences of their actions prior to reacting, and they had an improved ability to manage anger. The Mydev project ended in 2019, just prior to the start of the COVID-19 pandemic. But EDC is implementing a follow-on project in the Philippines called Opportunity 2.0, and we've adapted the same foundations of resilience in 2 ways in this project, in this new project, in light of the restrictions of the COVID pandemic. The first straightforward adaptation has been the lack of travel, right? So there's no international travel possible. EDC's US office-based clinical psychologists trained our Filipino staff virtually on the curriculum so that our Filipino staff can then in turn train the trainers on the content. The second adaptation I want to talk to you about was very significant. It has been unclear over the last year and a half if and when youth can gather for in-person classes. So we had to adapt the material pretty significantly to ensure that it would be safe and relevant as a self-guided course where youth could complete and self-teach at home. So this adaptation required a clinical psychologist to decide how to adjust the material and what needed to be removed. So this reduced the depth of sensitivity in the self-taught remote modules, as it was really important to consider that the youth and the children may not always be in a safe environment in their home, and they may not have the support to cope with emotions that come up as they process trauma. In closing, I want to bring us back to the call to action, which was detailed earlier, and we're talking about that today. And we have 3 key takeaways or lessons that we've learned from our Mydev experience and other projects as well that align very well with the call to action. As I stated earlier, both USAID and EDC came at this mental health intervention from the angle of how to support youth during and post-crisis. What we all learned very quickly is that there was really a need to prioritize more resources and support for the trainers and for the teachers. Both funders and implementers, we need to recognize that it's not just about how the youth deal with crisis and conflict or how the students deal with crisis and conflict. It's about their families. It's about the community leaders. It's about, of course, their educators, their teachers, their trainers. We'd really like to see a focus and set aside of resources for educators, teachers, caregivers, health professionals, whoever we are working with locally to support vulnerable groups. Teachers need and want to receive training in psychological skills in order to better support their own mental health and well-being and their students. As a leader in non-formal education, EDC is especially interested in making sure that our educators that maybe don't fall into formal education systems are not left behind, and that they also receive the support that will help them personally, professionally, and help them be better educators. The third recommendation is largely aligned with the last point in the call to action. Listen to teachers' experiences, listen to their expertise and opinions. We should not assume that teachers don't have time or the interest to deepen their own mental health skills and positive mental health coping skills. We shouldn't assume that because they're overburdened, they don't want to take this on. We have data that indicates that teachers are interested and they want to prioritize mental health support for themselves and their students. One example of this is in the DRC. Our teachers in the DRC, many of whom haven't been paid in months, 99% of them said to us that we are already supporting students who are victims of violence and trauma, and we don't know what we're doing. And that's very stressful. The teachers spoke about how that brings about anxiety and depression in them. They are asking for guidance on how to support themselves and their students. So we need to prioritize the teachers and their well-being. Thank you very much.
Thank you so much, Nalini. That was really informative. And yeah, it was good to also bring in examples from a non-formal education space as well. And yeah, the role that trainers play as teachers in those spaces. I'm just putting a link in the chat box now to a document that has that call to action on it and the different action points on the call to action. And there's some spaces there for you to reflect on or add comments to in regards to Nalini's presentation. We've got a little bit of time for questions, and I see a few popping up in the chat box here. Just because it is focused specifically on teachers and the project Nalini was referring to, I might start with Amy. So if Amy, you want to come off mute and ask that question, that'd be amazing.
Yeah, absolutely. Thanks so much, Nalini. Really interesting. I guess I had a question around the fact that you commented right at the very beginning that you hadn't, the focus was mainly really on the learners rather than the teachers. I was wondering that whether or not the experience of this program had led you to change or shift within either EDC or USAID sort of program design towards having a more equal focus on teachers as well as learners when it comes to well-being. Thank you.
Sure, thank you, Amy. I think that's it's a really important question, and I wanted to be very upfront and honest that our focus was not initially on the teachers, and that this was a really important learning for us at EDC as well as at USAID. And the Mydev project, which I was describing today, was focused on mental health interventions for out-of-school youth, right? And we did this robust, comprehensive training for staff and teachers in order to deliver that training. But as a result of what we have learned here in Mydev, in other contexts, when we're designing programs, we have that conversation right from the beginning. We ask if depending on which stakeholders we're talking to, we ask if they want part of the intervention to be focused on educators or students or both. And we're hearing different responses in different contexts. One example is in the DRC, we're currently implementing another USAID funded program, also out of school youth, non-formal education. And the interventions in this program are partly focused on teachers learning these skills for themselves. It's the same kind of skills, the same kinds of approaches, but it's contextualized for adults and educators and for the DRC context. So in the DRC, we're helping teachers on how to support students in safely describing histories of trauma. We didn't train the teachers on how to implement the mental health training with youth because that's not what they needed in that context during this project. The DRC educators really wanted coaching on how to discuss trauma. So we've had very positive results from these DRC interventions, and teachers are continuing to coach each other on how to discuss trauma amongst themselves and with their students. So there's definitely a need for it, but it needs to be prioritized and contextualized as well.
Awesome, thanks Amy for that question, and thanks Nalini for the really comprehensive response. Next, Sophia, I just want to invite you to comment, to I suppose relay the comment you made around adverse childhood experiences and teacher training, and then perhaps ask a question around the gender differences.
Sure, thank you, Chris, and thank you to our presenters. Very interesting. I was particularly fascinated by the point that you made about addressing brain development and cognitive development with teachers. I think it's super important. And some research that I've done here in the Dominican Republic, I found that teachers are less likely to empathize and tolerate misbehavior and misconduct when they're not aware of the kind of implications that it has in terms of how trauma and adverse childhood experiences have actually shaped brain development and are thus, playing a role in shaping that behavior. So I thought that was really fascinating, and I'm happy to hear that. I think that that's something that we don't talk enough in teacher training or teacher education programs. So thank you for including that. In terms of gender, yeah, I was just wondering if there were any gender differences and maybe how, I don't really know in terms of the Philippines if most teachers are female or male, or if there are any gender dynamics in terms of how teachers responded to the program. And then I would also follow that up with if there are any gender differences in terms of the students and the student learning as well. Thank you.
Sure, thanks for that comment and question. I will be very upfront in terms of the gender dynamics. We did not do any research per se. We didn't, look at the quantitative data, and we were not able to look at it from a gender dimension, other than to say we have X number of girls and X number of boys and X number of male and female trainers and trainees. So in the Philippines for this project, we had more than 50% female trainees, and depending on, so we worked in 11 different areas, and in each of the areas, the numbers were a little different for the trainers, but we had at least 50% of male and female trainers. In 2 or 3 of the locations, I think we had 70% of female trainers and 30% male. So, but we did not do something, and that honestly, that you hit my heart, because that's something that I focus on a lot in terms of gender work, and I feel that was lacking, and I hope we can do more of that research. We currently have a project in the DRC and in Honduras, where I hope we're going to be able to look at some of the gender dynamics. In terms of what you were saying about the cognitive behavioral therapy, and the importance of that, I think it's really important to understand the difference. This project was a mental health intervention, right? And it's a little bit more significant and deeper in some way than if we think about social emotional learning or psychosocial support. So I think of social emotional learning as social emotional skill building, right? That anybody can learn to do. Teachers can learn these skills, parents should be doing this. Social skills, emotional skills, life skills. And then you have psychosocial support, which is kind of coping support, especially for people who have experienced something that is difficult and they need that extra support to process that. And this project took it to another level with what we're calling at EDC mental health interventions. And it's a little bit more significant, right? We're developing coping skills to help students and educators who've experienced violence or trauma and struggle to talk about it. So it's a little bit deeper than psychosocial support and SEL. And that is one of the reasons that we had this focus on CBT and even ACT. So we looked at cognitive behavioral therapy and acceptance and commitment therapy, and that was really the evidence base for our curriculum content, right? With CBT being that our thoughts affect our feelings and behaviors, and as the thinking there is, as long as you can change your thoughts, you can change your feelings and behaviors. But we also added in the acceptance and commitment theory angle, where in order for people to change behavior, they have to reach a certain balance. You have to understand what you can and what you cannot accept, right? And you have some responsibility for it. So in terms of the curriculum material, we talk a lot about how life is hard, right? And there you are going to face challenges, and you have to find a way to cope with them. And evidence has shown that if you have people internalize your reality and that understand that life is meant to be difficult, they will be more resilient. They are expecting hardship, and they won't think that something is wrong with them when that hardship comes their way. They'll learn to cope with it.
Wonderful. And I might, just as we've only got about a minute left, well, I see exactly a minute left. There's a great question in there from Daniel, I think it was, around monitoring and evaluation tools. Just quickly, is there a particular tool to help measure the outcomes of this project?
Yes, so we have a youth perception survey. And again, our data and our impact evaluation was more focused on the youth than the trainers, but the same kinds of questions that we used for the youth can certainly be used for the trainers as well. So we had a youth perception survey, which was a self-reported survey for the youth to respond to their questions on their perceptions of community, their perceptions of the government, the local government, and their perceptions around violence, as well as their resilience skills. What I will do, since I know we're running out of time, is I will just pop our impact evaluation reports into the chat, and I'm happy to speak to anybody